Union Test Prep's CNA Practice Test. There will be a brief pause after answer choices are given. This is a great time to pause the video to solve. Question 1. A resident with dysphagia is on a pureed diet and thickened liquids. What is the primary goal of this dietary modification? A. To improve the resident's digestion. B. To ensure proper nutrient absorption. C. To reduce the risk of aspiration. D. To make food easier to chew. The correct answer is C. To reduce the risk of aspiration. Dysphagia, or difficulty swallowing, puts residents at risk of aspiration, where food or liquid enters the airway instead of the esophagus. Aspiration can lead to serious complications, including pneumonia or choking. A pureed diet and thickened liquids make swallowing safer by slowing the movement of food and liquid, giving the resident better control. Question 2. When measuring a resident's output, the CNA notices the urine is dark and has a strong odor. What is the most appropriate next step? A. Encourage the resident to drink more water. B. Record the observation and notify the nurse. C. Clean the resident and discard the urine. D. Check the resident's temperature. The correct answer is B. Record the observation and notify the nurse. Dark, strong-smelling urine can indicate dehydration or a urinary tract infection. It is the CNA's responsibility to document the observation and inform the nurse, who can assess the resident further and decide on the next steps. Question 3. A resident refuses to take their prescribed medication during your shift. What should the CNA do? A. Hide the medication in the resident's food. B. Leave the medication for the resident to take later. C. Insist that the resident takes the medication. D. Notify the nurse about the refusal. The correct answer is D. Notify the nurse about the refusal. Medication administration is outside a CNA's scope of practice, and hiding medication in food is unethical and potentially dangerous. The nurse must be informed to document the refusal and decide on appropriate actions, such as contacting the physician or discussing the issue with the resident. Question 4. Which of the following best describes standard precautions? A. Using gloves only when handling blood. B. Treating all body fluids as potentially infectious. C. Wearing a gown for every resident interaction. D. Disinfecting surfaces only if visibly soiled. The correct answer is B. Treating all body fluids as potentially infectious. Standard precautions are a set of infection control practices designed to prevent the spread of pathogens. They assume all body fluids, except sweat, are potentially infectious and include using gloves, hand hygiene, and protective equipment as needed. Question 5. A resident with Alzheimer's disease begins wandering in the hallway at night. What is the best intervention? A. Redirect the resident back to their room calmly. B. Lock the resident in their room to ensure safety. C. Administer a sedative. D. Leave the resident alone to wander if they are in a safe area. The correct answer is A. Redirect the resident back to their room calmly. Wandering is a common behavior in residents with Alzheimer's disease. Calm redirection respects the resident's dignity and ensures their safety without causing unnecessary distress or using inappropriate measures, such as physical restraint. Question 6. A CNA is assisting a resident with a partial bed bath. Which area should the CNA wash first? A. Arms. B. Face. C. Perineal area. D. Chest. The correct answer is B. Face. When performing a partial bed bath, the face is cleaned first to reduce the risk of transferring bacteria from other parts of the body to this sensitive area. Question 7. What is the best position for a resident receiving a tube feeding? A. Supine. B. Prone. C. Trendelenburg. D. Semifowlers. The correct answer is D. Semifowlers. Semifowlers position, with the head of the bed elevated 30 to 45 degrees, reduces the risk of aspiration during tube feedings by keeping the airway clear and preventing food or liquid from entering the lungs. While CNAs do not administer tube feedings, they play a critical role in observing for complications and reporting these issues to the nurse for further care. Question 8. A resident is on strict intake and output monitoring. What should the CNA include when documenting output? A. Only urine and bowel movements. B. All bodily fluids, including wound drainage and vomit. C. Only fluids the resident drinks. D. The amount of food the resident eats. The correct answer is B. All bodily fluids, including wound drainage and vomit. Output documentation includes all bodily fluids, as these measurements are essential for assessing hydration and fluid balance. Question 9. What is the proper technique to use when dressing a resident who has hemiplegia? A. Have the resident dress themselves to promote independence. B. Dress the unaffected side first. C. Alternate dressing sides to build strength. D. Dress the affected side first. The correct answer is D. Dress the affected side first. Dressing the affected side first makes the process easier and more comfortable for the resident by reducing strain on the weaker side, allowing the caregiver to gently guide the limb without forcing movements that could cause discomfort or injury. This approach ensures that the resident feels supported and minimizes the risk of overexerting the unaffected side during the process. Question 10. When measuring a resident's radial pulse, what is the proper technique? A. Use your thumb to feel the pulse. B. Count the pulse for 10 seconds and multiply by 6. C. Press lightly with your fingertips on the wrist. D. Apply firm pressure to ensure accuracy. The correct answer is C. Press lightly with your fingertips on the wrist. When measuring the radial pulse, it is important to press lightly with your fingertips, as excessive pressure can obstruct the pulse or make it harder to feel. Using your thumb is not advised because it has its own pulse, which can interfere with accuracy. Counting for a full minute is ideal for precise measurement. Looking for more study help? For free practice tests, study guides, and flashcards for the CNA exam, check out uniontestprep.com/CNA.